Hey guys, welcome back to Medical Coding with Blue. Today's episode is all about the things that you should think about before considering a career in medical billing and coding. If you're brand new to my channel, welcome. I am Blue. I'm a medical coder. Okay guys, disclaimer first. Two things. I am a veteran medical coder who has been a medical coder since 2008. So I've seen quite a bit of changes in this industry. I've seen the evolution of the electronic medical record, and I've seen the transition from ICD-9 to ICD-10. So when I speak from experience. Two things you gotta know. This video will either run you off from pursuing this field, or you will think that I'm being negative. I am not being negative. What I am telling you is what a lot of these recruiters from the school is not going to tell you. I'm going to tell you things that a lot of people don't really understand, as far as like some people speak like they have experience and they know, even though they're maybe in the medical field already, but they don't actually know. So whatever you get from this message today, just know that what I'm saying to you is from my experience, what I know, and what I hope that somebody would have told me being brand new. Okay, so with that said, I'm going to go ahead and get into it. So here we go. A career in medical billing and coding is rewarding. It is a fantastic transition career. If you have worked and you're retired and you say, well, I want to go and do something, let me try medical billing and coding. It is a great transition career field, like I said. It's also great if you are right out of high school and you say, I'm not ready for college yet, but I need to go to a trade school so that I can work in something. I can get my life started. This is a great field because it allows for growth. And it allows for growth whether you are brand new, right out of high school, or even if you are retired, depending. Retirees bring a lot of transitional skills to medical billing and coding, even though maybe they don't come from a medical background. Maybe if you came from a teacher's background, or maybe an accountant's background, something like that. Any of those things, there's plenty of things that can transition over into coding. But that's another episode. The first thing that you have to know is that when you're going to school, it's going to take a lot of study. This is not something that can be learned in 5 weeks. It is not something that can be learned in 4 months. And it doesn't matter if you have a medical background already. Because yes, while some nurses will transition from nursing into coding, you don't have to be a nurse. You just need a high school diploma or a GED to start this career field. Okay, so that's a great thing, right? Because it doesn't require a degree. Now, you will see in the job listings, if you're doing your research, you will see in the job listings that sometimes they ask for it, but it depends on the duties of that person. If they're doing like where they're doing auditing of other medical coders, sure, they are going to want a degree, because the degree holders are meant to be our leaders. But if you're just looking to be a medical coder, all you need to have is a certification. And there are two major medical coding associations, the American Health Information Management Association and the American Academy of Professional Coders. And I will leave both links to those associations in the description box. That way you can check them out, okay? All you need is one. That's all you need. You need only one certification. You need 20 hours per week to study medical billing and coding if you want to take this seriously. And if you want to be able to take your certification exam and be confident, you need those 20 hours, because that's what it takes. If you say, well, English is not my first language, it doesn't matter. Everybody needs to be able to understand what they're reading. They need to be able to comprehend all of these things. There's no room for complaining about the amount of reading that you have to do, because it is a lot of reading. And the reason that it is a lot of reading is because we're looking at advanced medical terminology in these documents. We're reading medical documents all day long. So you have to be able to understand the language. And it takes time to build that. So if you're not proficient right away, it's okay. The thing about it is you have to be consistent with your learning, which goes back to trying to squirrel in 20 hours per week. And it is possible. I have plenty of my videos on my channel that talk about how to reach that perfect amount of just study, and also being able to spend time with your family and your loved ones. Because I don't believe that you need to neglect your family during this time. You need to have their support. But if you don't have their support, which is sometimes the case when people start pursuing this, that's okay. You just have to believe in yourself. And as long as you believe in yourself and you drown out all the noise, even though I know it's hard, I know it is, especially if you want those people around you to be supportive. Sometimes they won't, because they don't understand what it's like. We have to know what doctors know while never having gone to medical school. Again, not something that I say to scare you. I wanted to prepare you. You know, we're reading these documents all day long, and we have to understand what this is and what are they referring to. And some of these medical terminologies, they sound very similar to other parts of the body, so we have to be able to understand those things. But there's this wonderful thing called Google that can help you along the way when you are studying, and even when you get into the real world. But when you are learning in these programs, and maybe you got into a program because they told you, oh yes, you can work at home and you can raise your kids and you can do all this. I always recommend to brand new medical coders that if you're looking to get into, or people who are considering pursuing this career field, I always tell them to at least count on being at a facility or at a doctor's office, wherever you're doing your first job. Consider being in person for the first few months, so that way you can get exposure to the coders, you can get exposure to the providers. When I hear from people who say, well, Blue, I want to pursue this, but I can only work remotely, you're already putting out expectations that I don't think this career field is for you personally. Because if you're putting demands out there like that, not knowing what it all entails, that's setting yourself up for failure. When people work at home right away, you miss out on the camaraderie of learning from other medical coders. There's going to be things that you will learn in the real world that were never taught in school, that were never taught in the books, that were never part of your program. And you have to have that in your very beginning part of your journey. You need that to establish yourself with a firm foundation of learning, okay? It's going to make it easier for you if you do it that way, if you're around other coders, if you get exposure to providers, because then you can learn from that experience. It's not forever. It's just for a short time, again, so that you can learn. So if you are wanting to do this, don't be so stubborn that you want to have your way. Absolutely, is working from home right away. There's going to be a time that is appropriate for you to be working in person, and that is in the beginning. So that's my advice, because ultimately I want to set you all up for success, not failure. So my channel is a little bit more abrupt when it comes to the information that I'm giving you guys, because there's a lot of coddling out there, and there's a lot of salespeople out there who want to sell and push programs. Because if you actually told people what medical billing and coding all entails, people wouldn't sign up for the program. So you have to dress it up and make it look pretty. And oh yes, you can work at home and you can get all these credentials and you can look so prestigious and knowledgeable and things like that. When you're a brand new coder, all you need is one. It is an expensive field to maintain. So this is why I say you can be just as successful having one certification versus the person who has 5 or 6 or 7 or 8 different credentials and has no idea what to do with them. Because I see that a lot in the emails that come to me. They say, well, Blue, I have all these credentials and I still can't find a job. You have all these credentials, you don't have experience, so why are you not passing these assessment tests from the employers? Because you're only focusing on passing tests to make yourself look more impressive, or to compete with other people who have nothing to do with you. Sometimes people will get caught up into this cycle of wanting to compete with other people in their class. Oh, so-and-so got this credential, that credential, and I want to get that too, and I want to get more than them. then again, this field is not for you, because this field does not need people who are going to try to compete with other people in terms of how many credentials they hold. Holding multiple credentials does not make you more money, and you can look at the job listings for that. All it's asking for is just one. So somebody with multiple credentials who's going to have to spend more money on continuing education units and more money to be able to maintain those credentials, rather than you with just the one. You would be able to make more money because you get to keep more of your money and not have to spend it on the association. There's plenty of free resources out there. There's plenty of books that I recommend on my channel. The particular brand of diagnosis book, procedures books, and things like that, all of those are in the description box below. And if you ask me, again, that shows me that you don't do your research very well, because it's right there, right underneath where I'm speaking. There's a description box and it's listed all there. And all of my videos all have the books that I recommend and the links to websites that I recommend. So I implore you to go through my videos and check them out, so that way you can learn to get more information on your own. Medical coding is not a we're going to hold your hand type of field. So if you're that type of person that needs your hand held, you want everything to be given to you on a silver platter, essentially, it's not going to happen. We have to be researchers. We have to be able to work independently with little to no direction. And for some people, that's very difficult. They need people to tell them what to do. And if that's you, you're going to struggle a lot, because you're going to be up against other veteran coders who are not going to want to hold your hand, who are not going to want to sit here and spoon feed you all the information or code out a record for you. I've heard from my other colleagues who say, well, Blue, we hired a new person at our facility, and boy, the second something gets difficult, they want me to code this record for them. And, I try to help them out, but, they have a credential just like me, and I don't think that's fair. It's not fair. It's not fair for new people to do that. And for the excuse of, well, they didn't teach us this in school. This is why you can get workbooks on your own and study independently so that you can get better. I believe that everybody who wants to pursue this can get better through practice. But there's a lot of people who complain, oh, Blue, I don't like books. Books are a part of our everyday life in coding. You don't have to be in love with books. And yes, there are some electronic encoders and things like that you can use, certainly. But it's not the end all be all to be able to use those encoders. You still need to be able to utilize the book. And especially when you're taking a certification exam, because you're not allowed to use an encoder. Okay. So that's the other thing that I wanted to say. Further, I want to talk about people who think that they can do this because they want to travel around the world and they want to be able to travel and connect to Wi-Fi and do this. No, you can't, guys. Now, I don't know every employer in the world, but I will tell you this. When you're hired to do remote jobs, sometimes, they are going to want you to be within a certain radius, because they're going to want you to be able to come in maybe once a month or maybe twice a month for meetings and things like that, or whatever else they have going on at that facility. So you have to be within a certain radius. And sometimes it's not. Sometimes it's like a contract thing and you could be living anywhere. But the company will usually send a computer. Now that computer has to be plugged into a secure internet line, because you can't be connecting to Wi-Fi willy-nilly, because that's going to expose the private information of these patients to everybody. And even if you say, well, no, I connect to a secure server. If you're connected to Wi-Fi, you are risking everyone's information. And you don't want to be responsible for a HIPAA breach. So that's the thing that I'm saying. And there's a lot of people who are ignorant to that, ignorant to the law. And, violating HIPAA is huge. You can't do that, and especially if you want to pursue this field. That's 100% of what this field is security of patient information. And so you are responsible for that. And like I say, you can't be out there traveling thinking that you can just do this anywhere and everywhere you want to. People have I've heard stories before where somebody was like, okay, well, I don't want to put in for leave and I work remotely, so I'm going to go and I'm going to stay in this hotel in Mexico and I'm going to connect to the Wi-Fi. Well, guess who got a phone call from the IT department and says, where are you? You have our equipment and you're out of the country because it's showing that you're connecting to this IP address in Mexico. You can't do that. So again, you have to think about this if this is the reason that you're trying to pursue this. It's not. It's not something that you should do. Now, you should pursue this if you want a challenging career, if you want to be involved in it, not just being a bystander and somebody that, oh, well, I want to work remotely so I can raise my kids. If you stop every 5 minutes while you're trying to code a record, you're not going to get very much done. There's a good chance you're going to miss out on something that should have been picked up. And guess what? The codes that you select, they are what the patient is going to be billed for and their insurance. If you code incorrectly, guess who has to pay? That patient. And if you don't code appropriately, let's say you code under what it should have been, guess who loses money? That provider, that hospital, that facility. And when money doesn't come in like it's supposed to, guess what happens? They start letting people go and people start losing benefits and things like that. So there's a whole trickle-down effect that happens when incorrect coding is done. Now let's not talk about when you overcode and all the fines and penalties involved with that as well. Because whether you undercode or you overcode, incorrect coding is incorrect coding, and you still get in trouble for it either way. So trouble meaning that, okay, now we're losing money and now your productivity, your accuracy is at stake and that kind of thing. So it's not worth it if you are going to be constantly distracted at home. Working remotely is a privilege. Before the pandemic happened, if you didn't have 3 to 5 years of experience, you were not working at home. Now that we've seen with the pandemic that people can work at home, they're more likely to hire you at home. However, it is getting harder again because people are saying, okay, well, we can be back in the facility, so we want the people who work at home to be experienced. So again, it doesn't really matter why you want to be at home in the first place. You need to get experience in a facility or around other coders, so that way when you go home and you work at home, you can be ready and it's not going to be so difficult for you. Okay. Now, again, I say this not to discourage you, but to prepare you, because this is what the real world is like. These employers know that they can be particular because there's a lot of people that are really smart out there. And then there's some people that are not so smart. There's people who will refuse to read the updated guidelines that get updated every single year. And so they can pick, they can be picky. All right. But again, this is where you can embrace the challenge, where you can learn to do your research, to study so that you can be prepared. And it doesn't matter if they're asking for experience, you can still apply anyway. Because if they say, okay, we're desperate, we're going to go ahead and hire somebody who doesn't have experience, let's see how this person does on an assessment test. And if you can pass that test with a very high score, you're going to have a chance to be able to get in. And that's how you can grow your career. And once you've been in for a couple of years, then you can do whatever it is that you want to do. If you want to do not production coding, but maybe you want to do auditing because you've gotten really good at coding, then that's great, because then you can develop into something else. Or if you want to be a supervisor, you can also do that as well. A lead medical coder, there's plenty of room for growth, but you have to be willing to be in it. And again, guys, this is not a fun ride. It's not always glamorous. The time that it's going to take for you to study and learn, the time that you have to devote for it constantly throughout the years, because the studying doesn't stop. The studying will always be there, and there's going to be times when you're not going to agree with your auditor. You have to learn to defend yourself, and defend yourself in a professional and appropriate way. And having your research and knowing how to do your research with the appropriate references, not just wecode.com, you have to be able to use these references like Coding Clinic, CPT Assistant, the Merck Manual, the official websites for these different specialty associations where they talk about the disease process in a more in-depth way, because maybe you and the auditor don't agree. Those are the things that you have to be prepared for. And even if you say, well, Blue, I'm a shy person, can I do this? Shy people do this all the time. I am a shy person. Believe it or not, I am very shy. But when it comes to this career field, I am more confident with this because I enjoy it. I enjoy the teaching aspect. I enjoy the coding aspect. I enjoy working with my providers. I enjoy working with other medical coders. That's what I enjoy. That's what brings me joy. And so if you want to pursue this, you have to be willing to pursue the things that are not so fun. You have to be able to know that there's going to be times where you're going to feel like you fail. But the only way that you truly do fail is if you stop completely. If you allow a knockdown to take you out, then this wasn't for you anyway, right? If you get really discouraged because you're not picking up medical terminology fast enough after 2 weeks, guys, that's something that you have to work on. You're not going to learn medical terminology in 2 weeks. You're not even going to learn anatomy in 2 weeks. It takes time. As a 15-year veteran myself, I am still learning about medical terminology and anatomy, but I know where to do my research, So that's the thing that I want to say, that it's a great career field and allows for a lot of personal and professional growth. But you have to be willing to be in it. And you have to be willing to give it what you want it to give you, okay? As much as you put into it is as much as you're going to get back. If you put minimal effort into learning medical coding, you are not going to be happy with the results, which is, well, we're not finding a job, we're not passing this exam, and that kind of thing. You want to be able to be at a point where you are passing your exam, where you are able to find jobs and things like that. And for those of you who say, well, I passed my certification and I still can't find a job, what does your resume look like? Resumes play a huge part in finding a job. If your resume is 2 to 3 pages, that's wrong. It needs to be down to 1 page, max 2, okay? It needs to go back 10 to 15 years. It doesn't need to tell us that you worked in the 90s. And even if you've never had a job or you've never worked outside the home, it doesn't mean that you can't have a fantastic resume. I know, because I am a resume writer myself. My rate and contact is in the description box below. But I've written for many people who have no experience in medical at all and never worked outside of the home. And they were just as successful because they have a good resume now. So just something to think about. But commit to it. Stick with it if this is something that you want to do. But just know that all these frilly things, they do come with time. You can work remotely later on, and as far as people getting all worked up about the salary and things like that, you have to work up in the salary range just like everybody else. A lot of these schools will put out the highest salary starting rate, and we don't talk about salary in specifics on my channel because every place is different. And people get upset about that. You can get upset about it if you want to. But every place is going to start you at a different rate. The thing about it is you can go to the Department of Labor or the Bureau of Statistics, and it will tell you in your area what medical coders make. And that's how you can have your jumping off point to know if you're getting paid fairly for a starting wage. But you have to work your way up. Everybody works their way up, including nurses. So that's just something that you got to know. Every place is different, like I said, but that's something that if you are being driven to this career field because of the money that you want to see, oh, they make such high amounts of money, but you don't want to put in the effort to learn, this is going to be a very miserable ride for you, okay? You have to embrace everything. And don't chase the money, because the money will come to you, okay? You don't have to worry about that. You have to worry about being smart and being able to pick up this information, grasp the information, and be able to do all those things. That's what you need to concentrate on. Don't worry about the money. It will be there and it will take care of you, but you got to take care of it. Remember. So that's just what I'm going to say there. I'm going to go ahead and wrap this one up. But if you choose to pursue this career field, get ready, because it's going to be up and down ride for a little while until you start gaining your confidence. Then you will see. But study, and study hard, okay? Make sure you study 20 hours per week, 30 minutes minimum, 1 hour maximum at a time. Take a break after 1 hour, because it doesn't have to drain you. You don't have to go for long stretches of time studying, okay? And make sure that you take time for your family and for your loved ones, because they need to know that you're not going to abandon them just because you're pursuing this. This can benefit them as well, as far as like you're going to be in a good job that you enjoy. It's going to make you happier. It's going to make you a happier person. And being happier is great around your family, right? So I'm just going to say that. And with that said, I'm going to wrap this one up. Thank you guys so much for joining me. If this video helped you, please like, subscribe, and share, and I'll see y'all next time. Bye.